Okay, so just to confirm, we have on the line Alan, Bryn, Stephanie, Bev, Linda, and Heather. And here in the support unit, there's myself and Zara. So Linda, I'm going to turn over the meeting to you, please.
Sure. Well, good morning, everyone. I'm just so pleased that we can get everyone on a Friday morning before the long weekend, and have a chance to talk a bit about sort of the next step that we'd like to see for the Knowledge Translation and Implementation Science Methods Cluster. And as you know, this is a sort of a collective effort that I'm really grateful that Beth Hoens is somewhere traveling, and she is really an important advisor in the support unit, and we cannot certainly do that without Alison Hoens' expert support. So what I'd like to do is to go through a little bit of a summary of the activities that we have completed and ongoing up to now, and end with lots of time for discussion about moving forward for getting our hands dirty. So Sarah, can we go to the next slide, slide 2? Okay. So if you are following along on the PDF that Alison sent to you a while back with the agenda, I'm going to keep mentioning the number of slides that I'm on, and you'll find that at the bottom left corner. So the objective of this morning is for us to provide a bit of a brief update of the Knowledge Translation and Implementation Methods Cluster, and also give us an opportunity to do a deeper dive to explore options for potential projects to move forward. So next slide. So here is a bit of an update, slide number 4 now. And so for those of you who were at the visioning meeting on March 17, you probably remember this very pretty picture that you're looking at right now. So at the visioning meeting, we recorded, some of the discussion by drawing it out. And so today, if you remember, we started off by coming together with 40 people in the room who are implementation science and knowledge translation methodologists, and some of the individuals who are doing a lot of practice in KT and implementation. So we started off by coming to some consensus about what we were actually talking about in KT and implementation science versus KT and implementation practice. And that was actually quite an important conceptual clarity that was needed, especially in the context of patient-oriented research. So we then encouraged participants in the meeting to really think outside of the box, which is what you're seeing at the center of this picture, that we really want people to focus on the discussion, that is, how do we advance the science in the area. Slide number 5 right now. So we brainstorm a lot about where we were now and some of our strengths and limitations in British Columbia that allow us to move forward. And on the right-hand side of the this diagram, you probably cannot see it very clearly, but those are little phrases of ideas that people put out that they talk about where they want to be and what they want to see in the next 3 to 5 years that would happen within the KT and implementation methods cluster. We're in slide number 6. So after the meeting, we're trying to get some feedback from the attendees, what they thought about the discussion, and of the 40 people, 21 of them actually gave us really in-depth thoughts about the meeting. And I would like to share with you a little bit of what people told us. So in general, people thought that the process and the content was very good. It was more than satisfactory, I guess. The rating was somewhere between 3.1 to 3.7 out of 4, and that is really credit to Alison's expert facilitation at the meeting. Vast majority of them, over 90% of them, said that they were really excited about something that happened in that day within the methods cluster meeting, and also what the opportunities are moving forward. people particularly talk about, the enthusiasm to advance the science, to collaborate and build capacity, as well as there was a genuine sense of commitment to work together. In the satisfaction survey, we asked people whether they had any concerns, and more than 60% of the people did talk a little bit about some concerns about the uncertainties, perhaps about what exactly was the priorities that we would come to terms with, whether there's resources to do that in the next 3 to 5 years, and what are the logistics of doing the activity. So next slide, number 7. So what we have done since the workshop was, first of all, to be able to engage people who were not in the not able to attend the visioning meeting, to also hear their thoughts about how they would like to move forward and share with them about some of the discussion, so that the discussion was actually snowballing over time, when we're able to engage and reach out to people who were not able to participate at the visioning meeting. We hosted a webinar for those who could not attend. Actually, we did 1 or 2 webinars about that, and we have a specific one that was going back to the patient partners. There were 5 of them at the meeting, and we reached out to the same individuals who now had a chance to talk to their patient partner colleagues about the meeting, and then get some of their reflections and feedback about how to move forward. We developed a summary of the workshop, which Alison has shared with all of you, just some of the goals and objectives and ideas to move forward that were identified by people in the meeting, and as well as ideas that came forward from individuals who were not at the meeting. We grouped them into themes, and then we shared the summaries and asked for feedback, again, in our knowledge translation and implementation science methodologist community. So we specifically want to hear what resonates with people and how would they like to be involved. And part of what we are doing in this webinar now is also to get your specific thoughts around, what resonate with you about what you're hearing, and also to specifically talk about ideas to move forward as well. Alison also had numerous individual conversations with people, and so we have started to consolidate some of the ideas around what are the objectives and what are the work plans to move forward. So we're going to move to slide number 8 and the analysis, and slide number 9. So here are some of the ideas about that we were able to tease from the participants at the meeting and beyond. And Beth and I and Alison did some work to think through what would be realistic goals and objectives about the methods cluster. And generally, we group things together and we come up with 3 goals and a set of objectives. The methods cluster, really, essentially, we're tasked with the obligation or the job to foster a community of methodologists in this province. And what we hope to do is to be able to advance the science in KT and implementation methods and apply to the context of patient-oriented research, which is what we need to do to support the mandate of the support unit. And under this particular goal to advance the science, we identify 2 objectives. One is that we think that we hope there will be sufficient resources to launch 3 to 4 projects that develop and study innovative KT and implementation science methods. And the second objective is really to build capacity in the area by ensuring that all the projects need to include a training component involving trainees of varying level, and as well as new investigators. And we also want to contribute to any of the relevant support unit training and capacity development activities. recognizing that the KT and Implementation Science Methods Cluster is only one of the several methods cluster in the support unit, we're looking to collaborate with other methodological areas like health economics, like real-world clinical trials, like patient engagement in research, all of these areas. So it's not just working within, but we're hoping that our work can also collaborate and influence with other methodological areas as well. So the next slide, number 10. The second goal that we would like to focus on is to make sure that we promote the use of the knowledge that are generated from this methods cluster, recognizing that sometimes KT and implementation scientists are really good at finding the problems in the healthcare, health services area that need to be solved, but sometimes we may not think as comprehensively in terms of making sure that what we find from our research actually also get out and to be used. So we make it as an important goal that we will promote the use of the knowledge generated within this methods cluster with an objective to ensure that all the projects will include and execute a plan to facilitate the dissemination and use of the findings. The third goal is to promote the field of KT and implementation science in general, and particularly in the context of patient-oriented research. The objective for that is really for our community in KT and implementation science to undertake activities to raise the profile of the field, starting in British Columbia. Slide 11. So what I'd like to do is to chat a little bit about the proposed project ideas that came from the participants at the visioning meeting and those who provided further comments and feedback after the meetings. And I want to highlight that we're talking about project ideas. So these are not the number of projects that we are telling people to undertake, but rather these are ideas that came out from people in our community, and now we're having separate discussion, like all of you, to identify what are the projects that could address some of these interesting ideas. So the first idea that people talk quite a bit about at the meeting is to have the opportunity to study innovative research methods. So a number of methods were mentioned at the meetings, including how do we use and optimize the design of effectiveness and implementation hybrid design, especially in intervention, health services intervention or implementation intervention testing. There was also ideas to explore the use and the methodology of social network analysis in knowledge translation research. So some talked about specifically around the use of innovative literature synthesis methods, like realist review as an example, which is a very interesting method, very useful, and it's an evolving method that can allow us to advance what we already know and apply it in a way that is efficient and meaningful. And also, there was ideas that talked about the developing methods that are responsive to policy change. So some of these ideas in particular were mentioned by people in health authorities in the northern and rural areas, as well as in island health, for example. So those are very interesting discussion. The second project idea that people mentioned was to develop and study new methods to ensure there's diversity in knowledge translation and implementation science. And under this group of ideas, people talk about perhaps we should have projects that examine methods to target different generations of knowledge users. And there were discussion around, well, do we need to develop guidelines to ensure diversity, to give specific attention to the indigenous population, minorities, new immigrants in particular, caregivers, so go beyond the patient community, but also the caregiver's perspective, as well as the vulnerable population in general that oftentimes may not be engaged as completely and efficiently in the knowledge translation process. Slide number 12. So the third project idea was to study innovative methods for scaling up, especially their implementation interventions that has been studied have been found to be effective in some of the local settings. How do we develop innovative methods that will help these interventions to now scale up to perhaps to the city level, to the provincial level? So this idea, people mentioned this idea was specifically thinking about, can we have projects that are dedicated to this area of studying, developing and studying innovative methods to help scaling up some of the things that we know is effective in terms of implementation interventions. And the last proposed project idea is to develop and study KT interventions based on the citizen science approach. So in the meeting, there was some discussion about how do we leverage technology, information technology, online technology, mobile technology to obtain patient and public contributed information through their own recording in terms of, for example, talking about their health, rating their health, their symptoms and treatment use and effectiveness, as well as contributing stories about their patient experience from various aspects. This is also leveraging some of the work in the monitoring self movement that people are using wearable technologies to collect a large amount of data on a day-to-day, minute-by-minute basis. So there was some discussion about, can we use these patient-contributed data and automatically recorded data to generate meaningful research questions, which is could be another way to meaningfully engage people in developing research questions. Because some of these ideas probably may not be even recognized by researchers in the research community as we are going through our train of thought in developing research questions in specific areas. So those are the 4 project ideas that we talk about at by the KT and implementation science community, through the various methods of consultation. Slide number 13. And now what I would like to do is to spend some time for all of us to, explore some of the potential projects and dive a little bit deeper. Slide number 14. So again, the current status, now we have 4 broad categories of project ideas: innovative research methods, diversity, scaling up, and citizen science. Slide number 15. So the focus of the call today, and it's not limited to this, but the reason we're trying to have all of you in this particular webinar is because all of you have mentioned some different, varying degree and different area of interest that is related to studying innovative research methods, maybe studying interventions or looking at the better ways to synthesize existing knowledge. Next slide, 16. And so what I would like to do is to stop for a bit and hear your thoughts. Are there potential projects that you see as areas that you think is innovative, it's feasible, that you'd like to be a part of or you want to lead? Or would you like to collaborate in some of those projects? So the last slide, which all of you have in your PDF, of course, you know where to find all 3 of us if you have questions. But right now, what I'd like to do is to go back to slide number 11, and just to show the proposed project ideas, and I would welcome your thoughts and questions. Steph and Alison, have I missed anything? Is there anything you'd like to add?
Bev?
No, that was good. Good overview. Thank you for doing that, Linda.
Nothing from myself. Nope, that was very complete. Nothing.
Thank you. So now the floor is yours, all of you.
So perhaps we can do a bit of a round table then. Could we start with Heather for your thoughts on any of these 4 general areas under innovative research methods?
Sure. First off, to say I'm really impressed that you were able to synthesize the number of ideas and thoughts that came at the meeting, because it was amazing when we were there to see everybody's thinking, and so I'm impressed with how well you've really distilled it down, and I think most of the themes resonate with me. I really think the idea in terms of effectiveness and implementation of hybrid design is great. Around exploring social network analysis, I have experience in that area and have done a couple social network analyses now. So one with Nellie Oakley and one in my PhD, and I kind of wonder what people were hoping for with that. So if we're exploring it, are we looking at it as a value in terms of a method, and then that's more sort of a literature review of how social network has been used in implementation science, or were they hoping for us to build capacity so that people could adopt something like that? I would love also with the other piece of exploring innovative methods in terms of literature synthesis. It's sort of the same thing of do people want us to use them and study them, or do they all want capacity building in that area? I think that's the one thing where I'm sort of unsure of what we should do. And then, of course, I think all 4 are really, really interesting, but in terms of methodology, probably the first 3, I feel like I could see clearer steps within them. But at this point, I'm not sure what we want to do within each 4 of those themes, if that helps.
So Linda or Bev, would you like to address any of Heather's comments before we move on to Stephanie, Alan, and Bryn?
Can I just ask for clarification? I heard the first part of it, Heather. Do we want to do and study them, or do we what?
Or do we want to build capacity within them?
Build capacity for
example, for doing social network analyses, or doing innovative literature syntheses. So I'm not quite sure if we want to make sure that we study sort of the value of those methods by essentially doing literature reviews and doing studies with these methods, or do we also want to look at like how likely is it that we can actually build capacity for people to use these methods? So, for example, social network analysis would require a significant amount of training for people to start using in their kind of KT repertoire. And so do we need to look at that piece as well? Because I think we do have to be thoughtful of any method that we start to think of as innovative and promote. We also need to be able to build capacity for people to do that method. So just something to think about in terms of when we go forward with these different pieces and what might be most strategic.
Yeah. Beth, would you like to follow up, or?
No, I mean, I'm sorry. I actually, when I was saying, just after I said, no, that was a good overview, Linda, instead of pressing mute, I pressed myself out of the call. So sorry. So I've only just joined it again. So I think we're doing a bit of a round table just with sort of initial comments. Maybe we should do that first.
Yes, that's what we're doing.
But perhaps I can address Heather's comment for a bit.
Okay. Yeah, please. Yeah.
So Heather, you know, thanks for the thought, and I agree with you that it is certainly important to pay attention to building capacity in any of these methodological area. And I think one example that I could give, perhaps, you know, to challenge the thinking about what we can do a bit further is that, so for example, I don't do social network analysis, so I cannot give that example, but the effectiveness implementation hybrid design. It's a relatively new method to study implementation intervention, and the hope is that we actually learn about what works and how to implement it in a faster rate. If you look at the literature in that area, most of the studies are done in sort of the mainstream population. Interventions to better strategy to manage diabetes, for example, in the mainstream population, and very few of the studies that are looking at using this method or how to execute this method in marginalized population, for example, in people who may be in hard to reach area, in rural remote area. So if we're looking at advancing this method and apply it in a different population that has not been used, the method has not been used in the past, I think that could be one potential idea that look at how to advance the application of this sort of evaluation methods in a slightly different population. What are the specific considerations? What are the barriers and facilitators to make it work? And I think that could be one example to think about how do we, as a methods cluster, to push the cont'd implementation science method forward and contribute to the science in the area. Does that help to address your question?
Yeah, I think it does, Linda. Thank you for that, because I think exactly that. So then we would be studying the kind of likely implementation of those methods. So you look at barriers, facilitators to doing that with a particular group, and then try to develop resources, tools, something from that allows us to be able to use that with groups that it hasn't been done with before.
Yeah, I mean, that's great. That's great. It's Bev. I think we so if we, just to be really straightforward, the actual training of people on a specific method would not be a valid project under this, but exploring the feasibility of the use of the method with a group and how it would be rolled out and et cetera, that would be. So again, keeping the focus on the study of how we get this in use. And then just one more thought on that too is, you raise a good point, Heather. We have to be careful to not go off and explore a bunch of innovative methods that are just way too costly to use and no one would ever be able to use them. So again, that feasibility piece would actually have to be really taken into account in the study of any method that we use in a project as well.
Okay, if I might, at this stage, if we could continue the roundtable so we can get people's initial thoughts, and then maybe we could get into a discussion once we've explored the initial thoughts. Is it okay if we move on, Heather? Okay, so Stephanie, what are your thoughts?
I don't have any specific ideas for any of these 4 different areas. I am also using social network analysis for my PhD and involved in another project. And one of the studies for my PhD is actually doing a literature review on social network analysis in KT and evidence-informed healthcare. So perhaps that shouldn't be a direction of this group since it's already being tackled. But yeah, I'm a trainee, so perhaps I help achieve this part of the training component of the group at this point. And I'm just interested in learning what other people's ideas are.
Okay. Bryn?
I guess I too don't have any specific concrete ideas, project ideas. As well, this seems to be a common theme. I use social network analysis for my PhD work. So it's a method that I'm interested in and that I'm knowledgeable about. I'm also interested in the idea of an effective implementation hybrid design, but to be honest, I don't really know that much about what exactly that is or what that means. So it's hard for me to comment specifically or to know specifically how that could be applied to a specific study.
Okay, thank you. Alan?
Well, the first thing I wanted to do was to loop back to the first objective under Goal 1, where it talks about innovative KT methods. And I think it's important to start talking about innovative models and methods. Bev and I have been doing a fair bit of work over the last several years on developing a complex systems framework for thinking through KT and some of the issues that come up, and they're quite different. So that, for example, things like co-production, feedback loops, and leadership really come out as critical elements to consider as part of any overall KT strategy. Indeed, we don't even talk about KT strategy anymore. We talk about system change, with KT just being one of the threads that's woven into that fabric. The other thing, for me, if you start thinking about not only the methods but the models, is that almost without exception, I think it's important to weave developmental evaluation into the design. The other kind of designs as well, like the hybrid designs we're talking about, but all of them need more process evaluation, and developmental evaluation is a good way to start doing that. In terms of specifics, with the social network analysis, what we've been struck by with recent projects is that it only gets you so far, and that in fact what we're really wanting to do is to understand the system as it currently exists, how the different players, different organizations currently are working together, what they give and what they get out of that system, what the expectations are for the performance of each of the partners in any kind of collaboration. So I'd like to broaden the whole language around social network analysis to include stakeholder analysis and other aspects of better understanding the current dynamics in the system that are either facilitating or getting in the way of good KT. And maybe the last thing I'll talk about briefly is the scaling up piece. We've done a couple of projects recently for the Michael Smith, one around clinical care management and the other the opioid crisis at the moment. And what's really striking in both cases is that there's a layering with the people that are setting the policy, the executives that are responsible for coming up with implementation strategy, and then the people actually doing it. They just don't talk together. There isn't any real crosstalk in terms of how do they see their worlds, what are the challenges they face, and so on. So I'd specifically, under scaling up, like to better understand that kind of multi-level framework and how that affects the way we look at things and study them. That's enough for now.
Thank you. Beth or Linda, would you like to address any of Alan's comments?
Beth, would you like to go first? I'm just really excited. Alan,
Yeah,
you know, I think you've outlined a number of projects that we can start thinking about. This is fantastic. Sorry, Beth, did I cut you off?
No, I just think I'd love to move the discussion based on all these comments to what is. I mean, we have such a huge opportunity here as a group, as a collective, to take on some projects that are going to take some of these ideas and thoughts and questions further. So let's talk about how we do that.
Okay, so can I just check in? Chris, have you been able to join us?
I have.
Hi, Chris. Sorry, we had to jump in, but I don't know at what point you were able to join us. Can you?
Yeah, I was in for your presentation.
Okay.
Thank you very much. I don't have any specific projects per se, but I do just want to make a few comments. I am quite interested in kind of the linking implementation science with kind of the effectiveness studies or efficacy studies, really. Because I really think, I mean, CIHR for some time has been recommending the incorporation of evaluation into studies, and I'm not sure the extent to which that has happened or how effectively it has happened. And in terms of making a methodological contribution, I think one of the things we might think about doing is finding ways to examine how that has worked, whether it has added to the value of the studies, and kind of what were the pros and cons of. I think also that's a big area we can do in terms of how people from this group might link with those who are doing some of those studies to engage and provide our expertise in that way. I have to say that I was absolutely fascinated at the workshop about the talk of citizen science. I know absolutely nothing about it, but for me, it rang very true, and I think that we're only going to see more involvement of people in the community who are interested or who they want to be involved, they want to engage, they want certain questions answered, and I think that we would be ahead of the game, we'd be ahead of the curve if we would put some of our resources into that area. I know nothing about it, but it sounds so fascinating.
Okay, so thank you, Chris, and thank you all. I think we're now, I think that there's clearly consensus and excitement that the analysis as to what the project ideas are seem to have resonated with people, and that everyone on this call sees that my sense is from your comments is that you see value in pursuing these areas, that there are Alan and Chris in particular have been able to identify possible routes we could go with this. So if we look at the first point on the thought potential projects, what we haven't had a chance to explore at all yet are if there's any of you who would like to take some leadership in any of these areas, or if there are people that you think that we should be reaching out to as potential collaborators on that. So can we focus a little bit more now on these three components? The ideas that have come up by Alan and Chris. Heather, what are your thoughts?
The one thing I was thinking of, Alison, that I didn't mention before, and I think it's come up in everybody's statement in terms of an important piece of KT, is the co-production piece, or this idea of integrated knowledge translation. And I'm wondering if that's something that could also be a potential product or project. So looking at innovative methods for co-production. So I just want to add that as an initial piece. And then the other thing I'm wondering about is I feel like it's hard to figure out who our leadership or collaborators should be in different pieces, because I think there are likely people doing these different pieces across Canada that we could sort of link in with and figure out, how to make the best steps forward that are really efficient. So I kind of wonder if there's value in reaching out broader, or what you're hoping the structure would be when you're talking about leadership and collaborators.
Linda, would you like to address the leadership piece?
Yeah, well, I think, first of all, I think we need to decide what, our sort of remember I mentioned that there will be resources to support about 3 to 4 projects. So of all the ideas that's been presented, and we've also talked to a number of individuals who are not at this meeting, and so so we're trying to come up with the idea of what or some consensus of what are the innovative thinking outside the box project that represent British Columbia resources and expertise. Now, going back to the concept of the support unit, that is a provincial entity. So I think while it is absolutely important to have national and international collaboration, I think it is difficult to be taken as a serious player without showcasing, some of the work that we can do and produce, products that sort of set us apart as the leader in some of the areas. So some of the project ideas and the actual project is the opportunity for us to, build capacity within the province. So I would suggest that when we're thinking about leadership for the projects and the collaborators and so on, I would really recommend to think inside the province for now, and I think there will be opportunity to reach out once we get, organized and have, start having productivity. Beth, would you like to add anything?
Yeah, I think really what ideally what we would be walking away from this call with is one or more of you who wants to just take and run with an idea. I mean, we've heard Heather, you just mentioned co-production. Alan, you mentioned a model. You can put those together and think of a co-production model, bring Chris's thoughts about evaluation. You could wrap some of this up and attach it to something that's going on in British Columbia right now and say, here's what we could study. And of course, Heather, that would necessitate saying, well, who else is doing this and who else knows about this? But that's almost part of the project development work. We just really want to kind of start to say, okay, let's walk away with the gist of an idea and have someone flesh it out and move it forward.
Okay, Stephanie, any thoughts on this piece of the conversation?
I'm not in a place to take on a leadership role at this point, but the idea that resonated the most with me was the looking at the crosstalk between the people who are developing implementation plans and those carrying them out.
Thank you. Bryn?
I would say I am probably not in a position to take on a leadership role as well, so I'd be interested in participating with projects. Yeah, I guess, like Heather, the thing that I find the most interesting is the idea of co-production, and also potentially the idea that when you're looking at implementation, it should potentially be multi-directional, not just taking something and putting it in somewhere, but also looking at how the way that people act or the way that things work then influence the way that you're developing the thing that you're trying to implement. And I think that that's an area that implementation science and knowledge translation is weak at, and that co-production fits into. And in terms of moving the field forward, it's an area that I feel strongly about. I don't necessarily know of any provincial initiatives right now that could segue into well. I know also in part of what I've been struggling with in terms of this cluster and how it fits with the wider SPORE initiative is I feel like a lot of the other methodological groups, because of just the nature of SPORE, have to grapple with a lot of these issues themselves. So I'm not sure if part of what would make sense, because I guess we're not necessarily supporting them, we're going to do our own project, but we could potentially also study the way that they are trying to do what they're doing as a project ourselves.
Linda or Bev, do you want to address that?
No, Bryn, I think that's a very interesting idea, and there was certainly a discussion about studying, the people who are doing the study within the support unit. So there's certainly an idea there. And I think, what is exciting about the methods cluster is that there is dedicated resource, and it's not, unlimited amount of funding, but, there is some resource that allow us to do methodological work that allow us to think outside of the box in projects that we know if we apply to a CIHR grant, chances are it's not going to get funded. But we know in our heart that it is important, it needs to be done. And I think that is the opportunity we have right now to look at what, some of the ideas that, Alan was mentioning around, developing innovative models in co-production, looking at systems, looking at, developmental evaluation, absolutely important. Hard to get funded by CIHR, perhaps. And what Chris is talking about around, how to apply the effectiveness in the hybrid design more creatively and efficiently in various populations. Like, those are the stuff that I think we probably can wrap our heads around in developing a project that is doable, or projects, not multiple, that we can, that is doable and produce product that will actually allow us to say that in BC, this is the model that we'd like to present and push forward, based on the work that is done by people in this province. So that's the part that I would encourage everyone to think about how to move forward.
And further, just one line further to that, I can assure you that the clusters are working together. So where there's projects that are pertinent to across clusters, that will certainly be the case moving forward. So Chris, we haven't had an opportunity to hear your thoughts about this piece of the conversation.
Well, I was interested in what Bryn said about thinking about looking at, within our network, what people are doing and how they're thinking about knowledge translation and what are the barriers and that kind of thing. And also just the opportunity to test some innovative models within, projects that are already being funded through SCORE would be interesting.
Yeah, I
feel like we shouldn't press. I know that we're probably want to move things along, but I think stepping back after this call and thinking more about it, and I guess I don't know enough about the projects that are moving forward in SCORE, and having some information of that would also help to think this through a little more deeply.
So, Chris, it's Bev. Because the support unit is an infrastructure and service provider, there aren't projects per se that are moving forward. So it's the facilitator of other work. Where there are some things going on is in the networks, the SCORE networks, which have a fairly tangential at this point, I would say, relationship to the SCORE support unit. Which is not to say that there's no benefit of studying it, but it's not projects per se.
But they are connected to projects that are going forward and providing consultation, right? Or facilitating that?
They are, well, so the support unit is providing services. Someone will call and say, I need some advice on this, that, and the other. There's not necessarily right now a very deep connection.
Got it.
There could be as we move forward. So, yeah, good question. I mean, I think there's something lovely happening here. There is a kind of convergence in the sense of, even Stephanie started out by making clear that you don't have, you're not in a position to take on any leadership, but noting your interest in this whole idea of the implementation scientists not being connected with the implementers, which Alan brought up around his policy work, especially with most recently with the opioid group and policy. And again, that's really moves into the co-production piece that then Bryn brought up, and Alan's talk of models. And just having written about this quite recently, I know that people are struggling with models as well as methods for co-production. And there's all sorts of things in the province that are happening, including the implementation of the support unit itself, that are meant to be co-production and co-implementation, but they're not doing it according to any kind of framework or model, and then looking at how it's going. So it's really a case of, if that's the focus of it, what could be the topic or the area that we study, and there's innumerable in British Columbia. And we don't have to come up with that piece on this call, of course.
So just to clarify, in our discussions with various people that have been a part of sharing their ideas to shape this cluster, we have approached various people who were interested in taking leadership, for example, in diversity, or leadership in the citizen science. So really from this group, given the feedback that you provided in the one-on-one consultations and at the workshop, our thinking around this was that there might be an appetite, and that has come out in the conversation as Bev has nicely summarized. It looks like there's, you know, an appetite within this group, particularly around the connection between implementation scientists and implementers, the co-production piece. And as, you know, Chris has stated, maybe, well, it's impossible within an hour webinar for people to say, oh, okay, well, this is the exact project idea, this is the question, this is how we're going to address it, this is going to take leadership, etc. But given the fact that we only have 6 minutes left on this call, what are sort of the parting thoughts around what we would like to do is take these conversations and weave them into the work plan for the methods clusters. So I'd like to just take a minute maybe and do one more round through to get people's impressions on other things that we should take away in thoughts and the process that you would like to do that. Like, is it okay if your thoughts as to whether we should set up a second call or whether you'd like to do the rest by email, how you might like to proceed that way. So working backwards through our list this time, Chris, what are your thoughts?
Alison, it's Bev. Just before you get people to go, can I just add something?
Yes.
Yeah, and you can't kick me under the table because we're not in the same room. So in case I shouldn't say this, but I would really, we've already heard Stephanie and Bryn talk about their capacity at the moment to take on any role, interest in it, but not any leadership role. It'd be great to hear from others on that, just so we know if they're comfortable to say that.
Yeah, there would have been no kick for that, Bev. That's quite fine.
Okay, good, good.
So, Chris and Alan. Chris first.
We may have lost Chris. I don't see her on the screen.
Yeah, I think so. You lost Chris.
Okay. So, Alan, by default?
Oh, boy. So I'm going to throw a curve at you. Rather than trying to define our own projects, I'd go on a shopping trip. I'd be looking for opportunities where there is system change going on and there's a need for more clarity around how best to think about it. I'd go in with a list of some of the criteria I want to see. I think I've heard that some kind of network analysis might be one of the good criteria. Developmental evaluation clearly would be another. And look at the different projects. So there's the opioid one that Bev mentioned, but I don't think that's probably the best for this purpose. Another one we work on is cities changing diabetes, trying to come up with a comprehensive multi-level strategy for that. So if you can find the right projects and see which ones would add the greatest value in terms of the goals of this cluster, that's where I think you'd be furthest ahead.
Right. So, Alan, appreciate that. And I think one of the things that I would suggest is that what Beth and I are doing more of a coordination and trying to get people together, you know, that kind of role to, you know, to get you know, some of the innovative projects going. Now, it does not have to be necessarily have to be a brand new project that built from the ground up. So some of the ideas that you mentioned that look at existing projects and look at how to apply, execute, you know, some of the existing methods and doing things differently, or thinking about how to apply those methods differently. Like that's sort of the direction to go. But it's individuals who are passionate about, you know, pushing the science of, you know, of developing and testing some of the methods and models in a specific context. Those are the individuals that we're interested in discussing the process further to take the lead and develop and the resources that you will need to carry out those projects. And so the work that Beth and I are doing are really put together these great ideas and ask for resources from the support unit by developing a work plan with individuals who are doing the project. So, so you're right that we shouldn't be shopping for project, and that's not the intent, but it's more in terms of what are the things that you're going to be doing anyways or thinking about doing, but you're looking for the resources to do it even better, and, you know, so we can work together that way. Does that help, Alan?
Yeah, and I would just add too, Linda, before you answer Alan, I think the key is, I agree with you that it's about looking for what will allow us to further this work, but I think we have to narrow the scope of what work, and I was hearing, and maybe it's just because I want to hear it because I love the idea of co-production models. You know, then you know, the leader or whoever would like to take this further goes shopping for a project that is doing or ready to do co-production, and the model could be tested. So we just have to make sure that it's framed enough first before we go shopping.
Yeah.
In thinking about that co-production piece, Bev, I think you made a really interesting point that I actually think that some of the shopping list has been done for us. So things like the REACH Awards, things like different grant applications, we can look at people who have applied to do co-production grants and research and start to understand some of the barriers, the facilitators, the pieces to that, what models they're using, and actually study all of those groups across lots of different grant opportunities in British Columbia, and then you actually start to get this list of who's trying to do it and what experiences do they have so far, and then how could we as a support unit help them.
And that's great, and that's an idea that if someone wants to take it forward, like yourself, for example, I know you mentioned that may not feel that is in the position, but someone would take it forward and develop, you know, the plan to study it like that, and the job for us is to help you frame it, you know, within the methods cluster and get you the resources to do that.
I don't know that we actually heard from Heather that she didn't have capacity, did we? Or
oh, I was just going to say, I like that idea. I like the idea that Heather suggested. Yeah, I think it sounds like an interesting one.
Yeah. But Alan, I'm sorry, I kept you off. Sorry.
I was going to just, sorry, it's Heather. I was just going to say, I didn't say I didn't have capacity yet. I don't actually know. This fall, we're developing guiding principles. We're doing integrated knowledge translation with people with spinal cord injury, so that's my big focus right now. But I am wondering if potentially these projects could sort of support that different work. I might have to be like Chris and have a little bit of a think about how these things could come together and how we could work together. But no, I'm not afraid yet.
Oh.
Okay, so given that's a great way to end, because I know the WebEx session is booked for another group after this, so I'm going to have to call a close to this. What I might add is that if you have any further comments, please share them by email. And Heather, with your permission, is it okay if we reach out for a follow-up discussion with you in regards to whether those there could be some alignment that way with the spinal cord project? Okay.
And before we finish, I really want to make sure that we follow up with Alan. You know,
Alan, I didn't hear Alan, I didn't hear whether you were scared yet, capacity-wise.
No, not scared at all, but you know I have the unique challenge of how do we position it so it's something our research group can be involved in. So, you know, we've been successful, but that's a strict issue we need to think through all the time. Happy to meet maybe one-on-one or with a small group of you to talk more about it.
Excellent.
Okay, and then Bryn and Stephanie, I think that we're hearing that you would like to be kept informed. And Chris, would you like any follow-up one-on-one call, or just being keeping informed as we're moving along?
Chris has left the call.
Okay, well, I'll follow up with Chris individually. Thank you all. Have a great day.
Thank you, everyone. Thanks.
Thank you.
Bye.
Bye.
Care. Bye.
What have we got here? Oh, goodness. Oh, nope, still on. Ugh. Still on. Oh, still sharing. Oh, still recording.